Implanting Children with Cochlear Implants by Aubrey, Rose, and Tillie.
Our position. We are arguing against the resolution that children should not be implanted with cochlear implants. Our argument. Cochlear implantation in children carries significant and often irreversible risks, including the complete loss of residual hearing along with high rates of device failure. Hearing loss and costs of cochlear implants. The textbook shares that people who have some hearing loss should not go through this procedure since a side effect can be all their hearing being lost from surgery. If a new bone coils around the cochlear or the coil that goes through the cochlear is too rigid and messes with the cochlear device, cannot work and cause the surgery to not work at all. This leaves a person to rely only on lip reading and ASL. Additionally, the textbook adds the cochlear implantations are extremely expensive and not always or are only partially covered by surgery. The price of just one cochlear implant can be $100,000, and since the devices only last up to 10 years, the person will have to keep getting implantations and spending more money, especially if they get the implant at a young age. Along with new cochlear implants, the implants need to be checked which involves hospital visits, which require money, and tests like MRIs, which are not cheap either.
The unpredictable nature. Even when a cochlear implant appears to successfully preserve some hearing initially, that success often is not permanent. Even among children who initially showed minimal change in hearing right after their cochlear implant was activated, a significant portion, 50 to 60%, experienced a decrease in their hearing thresholds by 2 years post-implantation. This demonstrates the initial hearing preservation is not always permanent. Additionally, the implant is not 100% fixed, and people often with implants also rely on lip reading and sign language. This evidence contradicts the idea that modern surgical techniques guarantee long-term hearing preservation. It proves the risk of losing the remaining hearing is an ongoing concern for families, not just a short-term surgical risk.
These are the surgical risks. Cochlear implantation is a surgical procedure, and like any surgery, it carries some risk. Possible complications include infection, dizziness, or balance changes, taste disturbances, bleeding, or temporary discomfort around the implant site. In rare cases, more serious problems such as device failure, fluid leakage from the inner ear, or injury on the facial nerve may occur. Most of these issues are uncommon, and when they do happen, they can be often managed with treatment or resolved on their own. People with cochlear implantation also have a slightly higher risk of certain infections, such as bacterial meningitis, which is why vaccinations are recommended before surgery. Overall, serious complications are rare, and most patients recover well with proper care. In this slide, these are our citations.